surgical option is called a femoral osteotomy, which makes a cut in the femur to tip the ball back towards the socket. First, your child will go to sleep under general anesthesia. Next, an incision is made near the hip. Then, the surgeon carefully makes 2 cuts in a wedge shape. This allows them to tip the head of the femur back towards the socket as needed to achieve containment. Hardware is added, usually a plate and screws, to secure the femur into its new position. After surgery, your child will stay 2 to 3 days in the hospital to manage pain and begin physical therapy. Depending on the situation, your child may receive a cast as well. The surgical option is called a pelvic osteotomy, where several cuts are made in the hip bone to reposition the socket back over the ball. First, your child will go to sleep under general anesthesia. Next, an incision is made near the hip. Next, the surgeon carefully makes several cuts around the socket. This allows the team to move or mobilize the socket back on top of the ball of the femur. Finally, screws are placed to secure the socket in its new position. After surgery, your child will stay in the hospital 3 to 5 days to manage pain and will work with our physical therapist to practice moving around. But sometimes a few key muscles can become so tight that they prevent the leg from having its full range of motion. When this happens, we may recommend a tenotomy, or the cutting of a tendon, to restore motion and containment to the hip. Once your child is asleep under anesthesia, the tendons of specific muscles, called the adductor muscles, are cut through a small incision in the thigh. This is a minimally invasive procedure and should help improve the range of motion in the hip. Often, a tenotomy is combined with casting.